Well, again, welcome to everyone. I'm so glad to see many of you online and joining me today to discuss the 2025 Part D basics. As you probably are well aware, we are getting close to the annual enrollment period, and with that comes changes. Each year, CMS, which is the Centers for Medicare and Medicaid, does review the different Medicare plan options out there. And in particular, we're going to talk about Part D and some of the changes that are coming for the new year. Some of you have already heard me say this, but if you wouldn't mind, please leaving your microphones muted for the duration of the presentation, but feel free to type in the chat. And then at the end, we will answer those questions. And also, if you'd like to speak vocally at the end, just please click on the raise your hand button and we'll make sure that you can unmute at that time and ask your questions as well. All right, so let's get started. My name is Kay Kissinger, and I'm a sales associate with Informed Choice. I have been with Informed Choice for a few years now, and prior to that, I've been in the Medicare market coming up on 24 years total. So it's something that I truly have a passion for. I enjoy doing, and I enjoy helping my clients to make sure that they find the right plan for them. And here's just my contact information. So if you do have any questions after today, feel free to call or email me, or you can always call the home office as well. So let's talk about Part D. There's A, B, C, D, and it seems like the letters keep going, but we're really going to focus in here on Part D. Sometimes people will say, well, what is Part D? Well, quite simply, it's prescription drug coverage. It was actually created by the government, by Medicare, back in 2006, and it was created to give people who are on Medicare prescription drug coverage. Prior to that, there were other ways that people had to secure prescription drug coverage, and it wasn't always the most cost effective or reliable way to receive your prescription drugs. So that's why this was created back in 2006. And as you can see here on the slide, well over half are currently enrolled in a Part D plan, whether it's through a standalone drug plan, which we'll get into, or maybe through a Medicare Advantage prescription drug plan. So other times people will tell me, well, what if I still have an employer plan that offers group coverage? As long as it's credible, that may be another option for you. There's other plans out there as well, and we can talk about those at the end. But just to let you know, a majority of the people do look at a Part D prescription drug plan. So let's talk about the basics of what it is. It's voluntary. A person does not have to enroll into Part D. So when you're newly eligible for Medicare, that is your initial coverage election period. And that's often when people start to look over plan options, compare their prescriptions to find a plan that meets their needs. Now, Part D was created by the government through Medicare, but you actually purchase it through a private insurance company. So as you know, there are multiple insurance companies out there that sell Part D plans. That's where you would actually enroll. So you don't enroll into Part D through the government, but rather through an insurance company. And as I stated earlier, there's different ways that you can enroll into a Part D. Maybe you have a Medicare supplement and now you need a Part D plan. That would be a standalone prescription drug plan, or commonly known as a PDP. Or maybe you have a Medicare Advantage plan where your Part D is all rolled in, so you get your medical and your prescription all in one benefit, and that's an MAPD. Now, each year, most like all other insurance plans, you can have a review done. And during that time is when you want to check and say, what are the changes for next year? We want to make sure that your prescriptions are still covered and it's still the right plan for you, and know that benefits can change on a calendar basis. So even if you're new to Medicare, let's say next month, remember in January, everything restarts and renews with Part D. Also, Part D covers both your generic medications and brand name medications. And we'll get into more of those details as we go. Now, when to enroll in Medicare depends on your situation. As I mentioned, if you're brand new to Medicare, so your first time taking your Medicare, you have a 7-month time frame surrounding your birth date, your Part B start date, which is typically your 65th birthday. Not always, sometimes it can be sooner. During that 3 months prior the month you get your Part B or A and B, and then 3 months after. That is your election, initial coverage election period, where you can choose a Part D plan. Then each year, as I said, is coming up just right around the corner, is the annual enrollment period. And that will begin October 15th and will continue until December 7th. During this time frame is when you can choose or switch your Part D drug plan. And then we have special election periods. Those are things that can happen throughout the year. It could be that you're coming off of an employer plan or maybe your spouse's plan, or you have TRICARE or VA and something is changing there. Just give us a call. We can walk through that to see if you qualify for a special election and when your next time frame is to enroll. All right, now let's talk about premiums. Now, again, remember the plans that you're purchasing for Part D are given to you or you're purchasing it through the insurance company. So they're going to vary company to company and even within companies, depending on the plan that you choose. Now, as we're getting ready for 2025, you'll see that there will be many offerings. Again, some plans even will have a $0 premium deductible. We don't know the 2025 benefits yet. That's coming soon, October 1st. But just know that there are many different plans out there, and the premiums are set by the insurance companies. Now, if your plan has a premium, so that's your monthly bill to be on the plan, you can choose many different ways to pay that. You can do that through a coupon book where they send you a bill in the mail. You can have that taken right off of your Social Security check or through a checking, savings. Some even do credit card withdrawal. So that's your option to choose. If you choose not to take a Part D plan at all, you say, no, thank you, that is your right because it is voluntary. But I do want you to know there is something called the late enrollment penalty. So if you go for more than 63 days without a credible prescription drug plan, and then you would like to take one, you can get a late enrollment penalty. So let me give you an example. Let's say you're retiring the end of September, you had your employer group plan, and you say, well, I'm really not taking very medications. I'm just going to wait till the new year. Well, that's going to be more than 63 days if it starts in January. So for those months that you went without drug coverage, so let's say in this example, October through December, there's a percentage penalty. Now, it's 1% for every month you've gone uncovered. So in my example, we're saying October, November, December. So 3 months, 1% of the national average, it's about 36 cents a month. Doesn't seem very much, but that stays on top of your premium, your Part D premium, for as long as you have a Part D plan, even if you switch companies. So that's the importance of talking with your agent to find out, okay, maybe I'm not taking medications, but is there a value still for me to take a Part D drug plan? And you can see right here, it's, saving you that late enrollment penalty. Okay. So that's what that late enrollment penalty is about. Now let's talk about the actual coverage stages of Part D. If you're on a Part D plan, this may be very familiar to you. If not, there are different stages. Part D has a yearly deductible, so that's the amount you pay first when you go to the pharmacy to pick up your prescription. After the deductible has been met, then you have a copay model where either you pay a set copay or a percentage for your medication. For example, let's say you're getting a generic medication and the plan that you've chosen charges $5 per prescription. That's your copay during the initial coverage limit. Once you've met the out-of-pocket maximum for that limit, then you'll go into what's called the catastrophic coverage. And here's where we're really going to talk about some changes for next year. But those are the 3 stages. So when you get into catastrophic, then the coverage is different. There are no copays, as there are this year. And then we'll talk about that for next year too, what they're talking about for changes. So let's start back with the first part, the yearly deductible. Sometimes people are used to this. Maybe especially if you're on an employer plan, you could, used to seeing, well, I have to meet the first 200 or 500, whatever it might be. With each company, they can choose what the deductible is, but the maximum they can charge as of 2025 is $590 for the calendar year. Okay. So this is that first stage for 2025, right? Once you get through the coverage stage, and remember, some of your plans that are out there won't have a deductible, or maybe the deductible only applies to their brand name medications on their drug formulary. Okay, so this is just giving you the overall benefit package, not your specifics with your company. That is soon to come after the 1st of October. All right, once you've met the deductible stage, then the second stage is the initial coverage limit. And this is what you're spending. So as I mentioned, let's say a $5 copay on your generic, and then whatever the insurance or the manufacturer, whatever it might be, is paying. Okay, so you're paying that set amount, either a copay or a coinsurance, which means it's a percentage of the drug costs. So if it's a brand name, typically we see those have a coinsurance because they're typically higher cost, but not always. And we typically see the lower generics or preferred brands have a copay. Those are more set standard. The maximum out of pocket, and here's the new piece that's really changed, is $2,000 for the calendar year. Okay, so if you remember in past years or even this year, the maximum was $8,000. So this is a big change. Okay, due to the Inflation Reduction Act, these are parts of the changes that we're seeing with the Medicare Part D. And sometimes people will say, well, what all goes into that $2,000? Well, it includes the deductible, like we just talked about, okay? And then it includes what you're paying here in this stage, your copays, your coinsurance. If you have a Part D plan now, you probably get your EOB, which is called an explanation of benefits from your insurance carrier. And in that statement, it will show what was billed to the insurance company, what the discounts are, what the pharmacy charged you, and then it almost has like a running total that tells you you are this far into your next stage or till reaching your $2,000. All right. Now, when you're in this initial coverage stage, as I mentioned, you're going to have different copays, depending on if it's generic or brand name. Typically, tiers 1 and 2 are going to be your generics, lower cost. 3 is going to be your brand name, but it's preferred, so not quite as costly. And then tiers 4 and 5 are the higher cost, where you may then start to see a percentage or a coinsurance rather than a flat copay. Again, remember, this is determined by the insurance company for the Part D plan you're buying. So not everybody's going to have the same copays. It's going to depend on the policy you've purchased. All right, now the third stage is catastrophic. So when you reach your 2,000 out-of-pocket maximum, remember that's your deductibles, your copays, your coinsurance. Once you reach that, if you should reach that, then for the rest of the calendar year, you will have no copays, no out of pocket for the covered prescriptions on your plan. So potentially, depending on what prescriptions you take, you could reach that 2,000 quite early in the year and then have no copays the rest. Or maybe you're just paying, generic copays and then that's what you pay for that year. But know that 2,000 is the new cap for 2025. All right, formularies. Now, formularies are the list of medications that are covered. Every carrier out there, has a set list that the government says you have to cover so many in this therapeutic class and that, and they can then add some additional, and then they can put them in the different tiers. Some carriers may say, okay, that's a tier 3 brand, and another one make that a tier 4. So again, that's the importance of working with your agent so that we can make sure we're looking at all those aspects to make sure you find the right plan. Okay. If you find that one of your prescriptions is not covered, you can request for them to do an exception where they review, they look at, typically they ask doctor notes, nothing you have to do, but they want to look at your doctor notes to see, okay, can we do something here? Can we possibly give an exception? And again, that's something you work with through your Part D provider. The network. Similar to a provider network, you want to make sure you can go to your pharmacy and get your medications. And what's really nice is some of the providers out there, they've got their preferred pharmacies, which then brings your cost of copays even lower. And you also have the offering of mail order. So if you like to get your maintenance meds, let's say every 3 months, right to your door, so you don't have to go anywhere, there are quite a few Part D plans out there that offer that. So that's quite a convenience for you if you like to get those through the mail. Now, let's talk a little bit about extra help. Sometimes people will, call us and ask us, I feel like the coverage that you're offering is good, but I just can't afford this or that. Well, depending on your income, you may be able to get low income subsidy or extra help for your prescription Part D costs. Now, we don't determine that, but that is determined through your state, or you can go onto ssa.gov and there's actually information on there. Okay, so that we can get that to you if you need that information. Again, we can't actually tell you if you qualify. You do have to find out through this program. But if you do, it's certainly a great help to keep the cost of your prescription drugs lower. Now let's talk about something else that's new for 2025. So this is where, if you remember, we used to call it the coverage gap or the donut hole. That's what I usually had people call that. That's going to be gone. So once you've reached your $2,000, okay, remember that's your deductible, that's your copays, that's your coinsurance, all of that. Once you've reached that, then remember there's no longer a copay. There's no longer an out-of-pocket. Okay. So that coverage gap or that donut hole is gone. It goes from deductible to your copay coinsurance stage to the catastrophic, which is the zero copay, zero cost. Right? As long as the prescriptions are on the formulary, of course. Something else for 2025, and this has been covered by some already, there is a covered insulin cap of $35 for a 30-day supply. Now, it's not every single insulin that's out there, but certainly there are some of the more commonly prescribed. So check with your doctor, of course, to make sure you're on the right one. And then again, have your agent check that to make sure that that is also on your plan. And then also many vaccines are now covered under Part D. So if you're not sure if your prescriptions are covered or your vaccines are covered, again, reach out, let us know. We can check that out once we have the formularies for 2025, which is coming in less than 30 days, so less than a month away. All right, this is the new prescription payment plan. And if you've been watching some of the different news shows or maybe just reading different articles, this is getting some buzz and it is something new. And what the idea behind this is to spread across your prescription drug costs throughout the year. Maybe you're on a very high cost medication. And so rather than having to come up with all $2,000 in the first month, you can enroll into this prescription payment plan. And this is available to anyone that takes a prescription drug plan, whether it's through your Medicare Advantage plan or if it's a standalone drug plan. Okay. When you go to the pharmacy, that's when you will learn more about that. And what it essentially is that the insurance company that you're enrolled with for your prescription drug coverage is willing to help you. They will bill you on a monthly basis to spread out the cost of your yearly prescription bills. Okay, so again, that's all going to be done at the pharmacy when you go to pick up your prescription. You can sign up for this before your plan starts so that it starts right away in January or at any time throughout the year. Okay, and again, it's voluntary. So maybe you say, nah, I'm just going to pay my copays as I normally have. You don't have to enroll in this. This is just another way to help people throughout the entire year, not have to come up with one big cost all at the beginning. Okay. So as I explained, you'll get a bill each month from your insurance company that says this is the rolling balance, just like you would from, let's say, a credit card or a loan or something like that. So you know where you're at so that you can pay it off throughout the year. Okay. And all the plans use the same formula. So it's not as though one is going to say, well, you have to pay, $700 this month and $30 this month. No, it's all calculated to your benefit to make sure you can afford to pay that. All right. And then again, this talks about how it works at the pharmacy. So you will be getting that divided by, whoops, excuse me. I went to one slide below. Pardon me. So I'm just going to go back to this slide. Again, that will all happen at the pharmacy. So once you have your drug plan solidified, you know what you'd like. Excuse me, when you go to the pharmacy to pick up your prescription, they will offer this to you if they feel that's something that you may qualify for. You don't have to take it, but just in case you start hearing about this and they say it's a payment plan, remember that's what this is about. And we're going to learn a lot more as it goes by. This is new for all of us. So we're all kind of learning together, but we want to make sure that we can educate you as we learn more. All right. So get ready, as we've talked about many, many times. October 1st, it's right around the corner. So make sure you're going to get a bundle of paperwork every year you do during the fall. But make sure when you get your annual notice of change, that's the one that's coming from your insurance company now, your Part D plan now, it will show you what the changes are. So whether it be premium, copays, maybe your drug is in a different tier, maybe it's a different level of the formulary, or maybe they added things to the formulary. That will be in that annual notice of change. So please check it out. Okay. It's an important piece to have with you. And that concludes the presentation portion of Part D and just some of the updates for next year. I see Renee and Jeanette have had a few questions on the chat. If anyone would like to verbally ask a question, please just raise, and then one of us will be able to unmute you.
I'm watching for raised hands, Kay. Don't see any yet. Oh, there we go. Let me see who that is. Larry L. Could you actually, we can't really unmute you. So if you could unmute yourself and just go ahead and ask your question. Go ahead, Larry. It looks like you're unmuted, but we're not hearing you. Must be some problems with the microphone there, Larry. If you'd like to put your question in the chat, we can get to it that way, no problem. In the meantime, we do have a question from the chat, Kay. Karen is asking, are chemo drugs considered under our drug plan?
That's a great question, Karen. And chemo drugs can be considered under the Part D, but it can also be considered under Part B of Medicare. It depends if it's an infusion or an injection. So it's not an oral medication. That will fall under the Part B, as in boy, of Medicare, rather than D. The D is going to be oral chemotherapy medications, things that you would get at the drugstore. Did that answer your question? Great.
Okay, so another question has come in the chat. If I have a prescription of Restasis, the monthly bill is $775. So I have to pay this entire amount every month until I reach the 2,000.
Okay, another great question. And I know Restasis is expensive. So depending on your policy, let's say you have a policy that has the $590 deductible. We know that's the maximum this year. You would first have to pay that $590 because Restasis is going to be considered brand name, and most of them charge that. After that, depending on what insurance plan you have, they may just have you pay a percentage. So let's say you pay the $590, okay, and then you've got the rest left. Let's say they charge 25%, just to go to the max on everything here. You're going to pay 25% of the rest of that $775, okay, for that month. Then the next month when you go in, because now you've met your deductible stage, you're going to pay the 25% of the $775 until you've reached the $2,000. Does that make sense?
Okay. Larry, if you wanted to try, I guess your microphone, oh, here it is. His question is in the chat now. The question is, if my husband can get a free Advantage plan with me when I turn 65 in October, can he cancel his Advantage plan for October 1st?
Well, that's an interesting one. Because typically Medicare Advantage plans, if they're not through an employer group, if they're individual, which they are, if they're not through an employer, you each would purchase your own. So, as far as joining yours, now, depending on if he's in his initial coverage election period due to Medicare, but if he's in a Medicare Advantage plan, that leads me to believe he's already used that election. So the next election would be the annual enrollment. So he can make a change after the 15th of October, but it wouldn't start till January 1st. If I'm understanding your question correctly. If not, please let me know and we can talk it through. Okay, they are through your previous employer. So it's a group Medicare Advantage plan. If he's coming off of a group plan, then he would have a special enrollment period, okay, which would allow for him then to join a different Advantage plan the first of the next month. He's got 60 days to do that if it's a group plan.
Okay, we also had a request here. Andy asked if we could share a list of the 10 drugs that have negotiated prices. Jeanette, thank you. She shared a fact sheet that you can access in that chat box to check that out. But I do know those negotiated prices are not going into effect for 2025, just an FYI. Checking for raised hands. Will Medicare still offer the quarterly credit for over-the-counter products?
All right. Well, and those over-the-counter benefits are awesome. I think they're wonderful, and I'm glad that so many companies offer them. And honestly, that's offered through the company, not through Medicare. I know sometimes we kind of lump it all together, but it's offered by the different insurance companies. So it depends. Again, we don't know the 2025 benefits yet to give you a positive yes or no. But it's been a very great benefit. So I hope to see that they're going to continue on for 2025. Again, it's going to be dependent on the carrier, the insurance company that you're purchasing your plan through.
And then a question from Mark. So we have the United Health Medicare Advantage plan. My husband and I both use, oh goodness, fluticasone, omeprazole, etc. They have always been free or no copay on our plan. So now do we have to pay for these?
Well, that's another really good question. We'll find out after the 1st. So after the 1st of October, we can get you all the good details. But until then, we don't know. And again, you're going to get that annual notice of change letter. And so if these things that you're, mentioning here are no longer covered or they now have a copay, those will be listed in that annual notice of change. And then if you can't find them or you're just not sure, give your agent a call. We'll be happy to look that up for you after the 1st.
Okay, I do not see any raised. Oh, here we go. Last year, I met with an informed choice representative and decided on an Advantage plan. There was no charge for that meeting. Is that same model used for my first yearly review meeting?
Yes, yes. That's something that we take a lot of pride in is meeting with our clients to make sure that we review their information, again, that we have everything updated and they're on the right plan. And, whether you want to meet in person or even phone appointments are becoming more and more popular, there is no charge. No, not at all.
So Pat asked the question, and it's if you want to field it, Kay, great, I can do it too. Is the $2,000 cap enacted under the current administration under the Inflation Act guaranteed, or could the Inflation Act be overturned by a new administration?
If I had a crystal ball, we know as much as they tell us. I hate to not be able to tell you yes or no, but you know, I can't say anything is guaranteed because yes, things, as we know, things can change. But as of today, we can only go with what we know today.
And the Inflation Reduction Act, correct me if I'm wrong, I believe Congress would have to undo that, not an administration.
Right. There's a whole bunch of steps, as we know, whenever there's
Yes.
anything added or changed. All right. Well, thank you, Mark. I see that you need to sign off, and I see a few others left, so you can't hear my thank you, but I'll send it out there in cyberspace and space. And I wanted to say thank you to others that popped on. I know some of you are leaving, one by one. So I really appreciate you took the time to share with us today and watch this. And remember, look for those ANOCs, and we'll still be on here for questions for a while, but I just wanted to make sure I got my thank yous in.
Karen asked, my informed choice agent retired. How do I get a new agent? Oh, if Kay is still not on, I did answer your question in the chat, Karen. Just give us a call at Informed Choice and we'll be happy to assign a new agent for you to work with.
Yes, yes. Thank you, Renee.
Sure, I couldn't hear you, okay? Are you
So,
going to have another meeting after October 1st?
you bet. We are going to have a few more of these Part D webinars. Well, actually, that's through September, but then after the first, and Renee, did those you have to tell me, and I'm sorry, but did those invites already go out for our different events?
Oh, all clients of ours are going to be getting mail from us within the next week, inviting you to our annual Medicare Health Plan Expos. So we do have meetings scheduled at this time in the Green Bay area. We have meetings in Sheboygan, in Beaver Dam, and in Madison. So if any of those are convenient, you'll have the flyers with all of the information in your mailboxes very shortly. Oh, and I'm so sorry, Jeanette. I forget about our Florida friends, and I don't know how I do that. But yes, in Fort Myers, Florida as well, we'll be holding meetings for our Florida clients. Okay. I don't see any hands raised. And I don't see any more, wait, what do we have here? Oh, I raised my hand. Oops, didn't mean to do that.
What would you like to ask yourself?
Oh my goodness. I think that's it.
Wonderful. All right, so for anyone else still on, thank you again for joining us. If you have questions after today, feel free to call or email. And then after the 1st of October, give us a call if you'd like to do a phone review or an in-person review, and we'd be happy to do that for you.